I am Dr. Supreet Soni, a dental surgeon by profession, and I've been, most of the dentists might know me because I've been lecturing all over the country. My son, he was suffering from severe headaches. Maybe you can, if we say migraine is pretty severe, these headaches were 10 times more severe than migraine. And the headaches would be very cyclic at 12 o'clock in the afternoon, 3 o'clock, 6 o'clock, and 9 o'clock in the evening. And it was becoming a mystery, and I had been to umpteen number of physicians. They would say it's just migraine, and studying orofacial pain and myofascial pain dysfunctions in our final year BDS, I said, no, these don't look like migraine attacks because they cannot be that cyclic. And we went to the neurologists, and even neurologists in Chandigarh or in the north of India, they said, no doc, these look like migraine. And I said, no, these are not migraine. Only one neurologist said, doc, these are cluster headaches. And that fit my description as well. And we started treating him for cluster headaches because earlier we were treating him for migraine, giving him sumatriptan, and that wouldn't work. Then we started treating him for cluster headaches, giving him oxygen, and that wasn't aborting the attacks. If I show you the list, he's been on antibiotics, antacids, anti-allergics, NSAIDs, triptans, oxygen, then magnesium, multivitamins and zinc supplements, calcium channel blockers, anticonvulsants, and even melatonin. We didn't leave any stone unturned. And it was becoming such a nightmare for me that I ultimately put it on our elite dentist group, saying he's taking medicines just like we eat chanas. And I said, see, my brain has stopped working, please suggest. And then they suggested that there are 2 doctors who specialize in orofacial pain. And luckily, Dr. Davis Thomas is in Chennai, and he said there are 2 doctors who are going to attend his symposium. Why don't you send the records to them, and they might show them to Dr. Thomas. And another doctor suggested that there is Dr. Ruchika Sood in Bombay. She has done her master's degree with Dr. Davis Thomas, and she can be of a good help. And I said, fine. I contacted Ruchika, and I told her, Ruchika, this is what my son is going through. And she says, did you talk to Dr. Davis? I said, yes, Dr. Davis was so nice to call me just after the symposium.
Something has gone wrong. Okay, we can continue.
So, and finally, we were more scared of bringing Arnav from Chandigarh to Bombay because Dr. Davis was under the opinion that if you come by flight, the hypoxic situations might precipitate the attack. Luckily, tramadol started working, and I gave him a tramadol shot before the flight. We landed here and straight to Dr. Ruchika. Dr. Ruchika, she started palpating, she pressed on the masseter here, and the pain would go in the supraorbital region. And then while palpating, she pressed on the cervical nerve and alveolar. That's what precipitated the same kind of attack what Arnav would get. And the only thing Ruchika told me was, Supreet, if I can reproduce the attack, I can cure it. And we've been here for the past 15 days in Bombay, and he hasn't had a single attack. Thank you, Ruchika. Thank you so much.